So moving on to the introduction, Eisenmenger syndrome and pulmonary hypertension prove avoid or early pregnancy, and the guidelines suggest avoid or early termination of pregnancy. But there is an increasing pregnancy trend in developing countries, and regarding pre-pregnancy counseling and management, it's highly debatable. So this study aimed to compare and analyze clinical characteristics, management, and outcomes in pregnancy complicated with these disorders. So this is a prospective observational cohort study conducted at Women and Child Hospital, Zimmer, during June 2020 to June 2022 after getting it. So after getting consent, all women with these disorders were admitted and monitored during pregnancy and postpartum till discharge. And we included the demographic, clinical characteristics, echo, PA, specific management, mode of delivery, anesthetic management, and fetal-maternal outcomes. So moving on to the result, there were 30 pulmonary hypertension cases and 20 Eisenmenger syndrome women. And among them, 17 women with pulmonary hypertension was in WHO type 2, means with cardiac disease. And we found that majority of the women in Eisenmenger syndrome was primary gravida, and newly detected cases were also found, and it was high in pulmonary hypertension group, which was 43.3% and 15% in Eisenmenger syndrome. And regarding NVH, 36.7% of PH, women in PH group was in NVH class 1 and 40% in Eisenmenger syndrome with NVH class 3. 40% of cases with thrombocytopenia and 40% of cases with hypothyroidism. And the right ventricular systolic pressure in Eisenmenger syndrome with a median of 96. And these were the medications we given for this woman. And sildenafil was given in 75% cases of Eisenmenger syndrome, and oxygen supplementation was required in 100% with Eisenmenger syndrome. And regarding obstetric and anesthetic management, gestational age at delivery with 6 weeks in Eisenmenger, 10 weeks in pulmonary hypertension group, and 36 weeks in Eisenmenger syndrome group. And vaginal delivery group, which was there more in pulmonary hypertension group, which was 46.6%, 15% in Eisenmenger syndrome. And cesarean section was around 50% in Eisenmenger syndrome. And we have given epidural nearly both pulmonary hypertension group and Eisenmenger syndrome. And regarding maternal outcomes, number of women requiring high dependency unit was high in Eisenmenger syndrome, which was almost 100%. And length of hospital stay was high in Eisenmenger syndrome. And new onset heart failure and new onset hypertension group, around 60 and 50% in Eisenmenger syndrome, and there were 2 maternal deaths in pulmonary hypertension group and 3 maternal deaths in Eisenmenger syndrome group, and all these deaths occurred during the postpartum period. And regarding the fetal and neonatal outcomes, there were 3 perinatal mortality in pulmonary hypertension group and 1 in Eisenmenger syndrome group. And requiring 65% cases with NICU admissions were there in Eisenmenger syndrome, which was around 65%. So moving on to the discussion part, maternal mortality worldwide in these categories is around 50 to 60%, and in developed countries it's 15 to 30%. And pressure, pulmonary hypertension, pressure, and this pregnancy complicated by pulmonary hypertension appears to be safe till 40 millimeter of mercury. And here in this study, all women died during the postpartum period, so intensive monitoring required. And pulmonary hypertension targeted therapy, sildenafil was used in majority of this women. And we found that vaginal delivery and epidural anesthesia are safe and with good maternal and fetal outcomes. So regarding the strength, this is a large prospective data covering the clinical characteristics, and the sample size is less. And moving on to the conclusion, maternal mortality and morbidity have substantially come down in this woman, but with Eisenmenger syndrome it's still high. And early referral to a tertiary care center with multidisciplinary management with intensive monitoring is required. And women with pulmonary hypertension should seek a pre-pregnancy counseling from a multidisciplinary team to decide on reproductive choices depending upon the severity. And presentation of this presentation.
Divya. Thank you, Dr. Divya. And now we have got Dr. Reshma R. She's DNB resident at SUT, Trivandrum. The topic is carbetocin versus oxytocin, a comparative study on effectiveness in active management of third stage of labor. Thank you, Dr. Divya.